Buoy Health Insights, Imbalance or Floating Feeling. Hello viewers, and welcome to Buoy Health Insights, where we delve into health topics and provide you with comprehensive information. Today, we're discussing the sensation of imbalance or a floating feeling, which can be a puzzling and uncomfortable experience. Imagine standing still and suddenly feeling like you're moving, or that the room around you is spinning. This sensation, known as vertigo, can be linked to issues in your inner ear, which is responsible for your sense of balance. One potential cause for this imbalance or floating sensation is temporomandibular joint dysfunction disorder, or TMJ disorder. TMJ disorder is characterized by long-term pain and dysfunction in the joint that connects your upper and lower jaw bones, the TMJ. If you are experiencing pain, restricted movement, and clicking sounds from your jaw, along with a history of headaches, you might be dealing with TMJ disorder. Common treatment steps include using ice packs, eating soft foods, gently stretching the jaw muscles, managing stress, and sometimes using pain medications. Another condition to consider is post-concussion syndrome, PCS, which can occur after the initial symptoms of a concussion have passed. Sufferers of PCS may encounter persistent headaches, confusion, memory problems, and difficulty concentrating. If you suspect you may have PCS, seeking medical consultation is advised, as a healthcare provider can conduct a thorough review of your symptoms and possibly order an MRI. If you're hearing a ringing, buzzing, or whining sound in your ears, this could be the sign of non-urgent tinnitus, which usually indicates damage to the nerves within the ear. Tinnitus typically comes along with some degree of hearing loss and can be quite disruptive to your life. Treatment may involve hearing aids and addressing any underlying conditions you might have, such as high blood pressure. For those experiencing severe attacks of vertigo, tinnitus, pressure inside the ear, and hearing loss, Meniere's disease could be the culprit. Meniere's disease is a disorder affecting the inner ear, and thus your balance and hearing. The symptoms come in unpredictable episodes and can progressively worsen over time. Labyrinthitis, an inner ear infection, can also lead to sensations of imbalance. Following upper respiratory infections like the common cold or the flu, you may experience vertigo, nausea, vomiting, hearing loss, and ear pain. With labyrinthitis, viral symptoms often resolve on their own, while bacterial cases may require antibiotics. Positional vertigo is another reason for a loss of balance. In this situation, small calcium deposits develop within the semicircular canal of the ear, which helps control your balance. The calcium deposits interfere with signal transmission as you change position, causing you to feel off balance. This can sometimes be corrected through particle repositioning movements of the head, which allow the particles to exit the semicircular canals. Lastly, something as simple as earwax buildup can occasionally lead to bouts of dizziness and should not be overlooked as a possible cause. The impacted earwax can be treated at a clinic, and you should avoid using cotton swabs, which may push the wax deeper into your ear canal. If you're experiencing these symptoms, it is crucial to seek medical care, especially if they're severe, prolonged, or worsening. In particular, if you experience sudden hearing loss, have a fever, or feel as though you may faint, these could be signs of a more serious condition that warrants immediate attention. Remember, this information is for education purposes and not a replacement for professional advice. If you found this video helpful, do give it a thumbs up, subscribe to our channel for more insightful health content, and don't hesitate to share your thoughts or questions in the comments section below. Thanks for watching, and we'll see you next time on Buoy Health Insights.